Welcome everybody to our webinar.
Hello everybody. We're excited to reconnect with our patients and look forward to share some of our new knowledge.
So we're going to be talking about how to live and thrive, not just live, but also thrive in the time of the COVID pandemic. And it's been close to 1 year. It's been pretty hard for anybody, no matter if you're just getting started in life, in the middle like myself, and more advanced. It's been pretty hard, and we all have personal and professional challenges that are normal, just anybody living in this world. But a crisis is almost too good to waste. And at the time of a crisis, we must make good decisions and take the right actions, because anything that we do directly affects the quality of our life. And to be successful and have success in dealing with the crisis is a decision. It's also a mindset, and you can decide to be successful, whether you think you can or you can't. It was once said that you'll always be right. And Ari and I thought we could. We thought we could open the office early on in the game, equip it to the highest level. We are now considered the best protected office in the dental community. So thank you, Ari, for doing this together with me and doing all the research and equipping our office with the most protective measures for the sake of our patients, our team members, and ourselves, because we love coming to the office, love working, and we want to do this in a safe way. So a lot of the lessons that we learned during this almost year of a pandemic, we are personally implementing in our personal lives. And those lessons in regards to disinfection and protection, you don't have to be a doctor. You don't have to run a busy practice. We distilled those lessons into some of the teachings in this webinar. And we wanted to share them with you because we want you to be safe and stay healthy. And if you were affected by COVID, if you got sick, there are very good measures to take care of that and make your immune system stronger. And that's what this webinar is all about. So in today's webinar, we'll start with two hot topics. We'll talk about the vaccine. We'll talk about COVID testing, and also the new protection practices. We'll give you an update on what's new with masks, the new supplements that we use to strengthen our immune system, and also talk a little bit about the dental effects of COVID, and teach you how to self-check for oral disease, especially if you haven't been to the dentist in a long time. Being at home, being scared to leave and go to a medical building, will give you some advice on what you can do at home. And we also wanted to share some great things that happened in our lives. This pandemic, we never wanted to stay in the fetal position and not leave the house and be scared. Quite the opposite. We proved that you can thrive in this pandemic. You can practice in a safe way. You don't have to be depressed. And in many ways, this was a time of growth and fulfillment for both Ari and myself. And it was a pleasure to do this with Ari and doing it together as a team. So let's get started. Let's start with hot topic number one, the vaccine. Everybody's talking about the vaccine. More and more people are getting the vaccine. Our whole team is in the process of vaccination, whether it's Pfizer or Moderna. We all feel it's a very important measure we need to take as another layer of protection. And naturally, we will not give you any medical advice. We are not physicians. We are dentists with medical and dental knowledge, but we wanted to share with you the thought process and the research that we did when it came to vaccination. So a lot of questions that we were asked, like, should I get the vaccine? What are the pros? What are the cons? Should I get the Pfizer or should I get the Moderna? And we'll give you some tools to make those decisions. So first of all, it's important to understand that this is a new type of vaccine. It's called the mRNA vaccine, because conventionally we would get a vaccine that is either a weakened or an inactivated microorganism like a virus that has been injected into our body, and then our immune system responds. This vaccine works completely different. What is an mRNA vaccine? It basically teaches our cells to make the spike protein of the COVID virus. If you know the classical picture of the COVID, it has those little spikes. That's actually a protein that this virus creates. So it's giving the body a recipe to create this protein, and then our immune system does the rest. It creates the antibodies and creates an immune response. So when an actual COVID virus enters the body, the immune system is ready for it. So that's the mRNA vaccine. So the spike itself, we don't have to be scared. What the vaccine itself is not the virus. It allows our body to create this protein that by itself is harmless. So a common question is, should I get a Pfizer or Moderna? First of all, we don't always have the choice. We'll talk a little bit about it in a few slides, but it's quite hard to get in. We'll talk about how we got the vaccine ourselves. But basically, the Pfizer and the Moderna have the same mechanism. The difference is that Moderna has more than three times the concentration, but they're just as effective. They're about 95% effective. And the waiting time between the first injection and the second injection is 3 versus 4 weeks. That's really the difference. And Ari, I'm not sure if you want to relate to that, but I also heard that there is a faster immune response in the body for Moderna.
When we hear the news, luckily a lot of great research is being done now, but we can't forget that this all is very new. So every day we get new news. So for the question, which one should we choose? I think whatever one you can get, because both of them are very effective. And the only difference is that for the Pfizer, you have to wait only 3 weeks, Moderna 4 weeks. But in the latest news, it has been shown that Moderna, after 2 weeks, gets you very close to 90% already protection. But at the end, it's all the same. So my advice to all my patients or my family members, because it is so difficult to get a hold of an appointment, get either one of them, because at the end, you're going to be protected at the same way.
Excellent. And again, we cannot tell anybody to take it or not take it. This is not medical advice, but we wanted to give you some tools. So for any decision, we need to think about pros and cons. The pros of taking the vaccine is, first of all, it's available now. We have a pandemic. We have a pretty tough situation in our little hotspot here in Los Angeles. It's available for us now. It's possible to take. There are minimal side effects. I personally had just a little bit of just a little bit of pain in my arm. I was a little bit cold the next day, but nothing significant. It was shown to be very effective, 95%. And if you think about comparing the side effects of this type of vaccine, even the worst side effects, and comparing them to the COVID symptoms, we know which one is worse. Obviously, the COVID, not to mention the long-term COVID side effects that are now being reported more and more, heart conditions, immune conditions, other things that really stay in the body for a long time, if not forever. Let's talk a little bit about the cons of taking the vaccine. There are no long-term side effects that we know about. There could be some things that we don't know that will develop in the future. It is very possible, like many vaccines right now, that will need to re-administer next year when there are mutations in the virus or if new vaccines are being developed. The vaccine itself, and that's an extremely important point, is not 100%. We still need to use PPE and protect ourselves. And you can still carry and transmit it. So looking at the pros and cons, we definitely felt that it's extremely advantageous to take it. And we're looking at the vaccine as just another layer of protection on top of the PPE, your masks, your shields, your hand sanitization. one more layer of protection is just an important thing for everybody, but we still must protect ourselves. Another question, should I wait for the Johnson & Johnson vaccine? It's a different type of vaccine. It's not an mRNA vaccine. It's called a vector vaccine, meaning the spike protein is being attached to another virus that is harmless, and that's injected into the body. And it seems to have a lot of potential, but it's not available at the moment. And like Ari said, I 100% concur with Ari. Uh, if we have the opportunity to take the vaccine, take the vaccine.
My point for the Johnson vaccine is that it might be as effective, it might be slightly more effective, but the big disadvantage for me is that you have to wait for it and be exposed to get COVID and not be covered. So that's not worth for me to wait. If for any reason you don't fit in the age group or you don't fit in the criteria to be vaccinated now, you have the luxury, because you are not in line to get the vaccine, to have a choice somewhere down the line. But anybody who has a choice now to get the vaccine, I would say get the vaccine now.
Excellent. And there'll be more vaccines later. There will be more research. We will probably need to take different variations and versions of the current vaccines. And like anything in medicine, things are getting better and will get better. And we just need to beat this pandemic in any possible way. So whether you're taking the Pfizer and Moderna in our team, we're about, I think, 50-50. It was all dependent on where one could get an appointment. And from what we are getting, the feedback we're getting from our team members, that there was really no significant side effects. Everybody showed up to work the next day, including myself, including Ari. It was a non-issue. So when you're getting the vaccine, we wish you an easy experience. How to get it is a different story. Any challenges, Ari, that you noticed?
Definitely. Unfortunately, because of the limited supply and us being in a large city, it was advantageous for me to have computer skills, to have the luxury that when I'm at work, that I had family members who are computer savvy. And even so, we dentists were in the second stage after all the doctors in the hospitals have been hospitalized, and we had priority. It wasn't very easy to get appointments. So for anybody who is in line now, just because you're eligible doesn't mean that the appointment's available and open for you, but there are appointments available. The vaccine supply is being enlarged. And my only recommendation is, just because at the first try you're not getting an appointment, please be persistent. Literally, I would say 2, 3, 4 times a day, check the website, and have the help of family members to check if you're at work or don't have the time to do it. But I think eventually, with soon the pharmacies getting the vaccine even more, besides the very big, large pharmacy chains, I think it's going to get easier and easier. And here Ziv will give us some idea how to sign up for it on the computer.
Yeah, so the easiest part, and of course you have to answer questionnaires to go to the LA County website and book your appointment. And of course, there's this certain criteria depending on your age group. Currently over 65 only, unless you're a healthcare provider or working and exposed to patients or people that are potentially harboring COVID. A question here from Virginia: is it more likely to have adverse reaction to the Moderna compared to the Pfizer because it's 100 milligrams versus 30? Not according to the studies. The side effects were very equal. And what's interesting is that in these studies, the placebo group also had side effects, meaning the patients that never got the vaccine, they just thought they got the vaccine, they also had some side effects. So there are no real differences. And a question from Jack: are these vaccines technically experimental? Well, they had tens of thousands of people that have gone through the experiments already, and it's now approved for use. So they're not considered experimental anymore.
And just to interject, for anybody who's on the computer and saw the slide before, please be careful. It's now confusing because there are certain sites which are giving only the first dose. There are certain sites that are giving only the second appointment. And please be aware that I think the general rule from now on, it was very confusing at the start of the vaccine application. It's very important that you know that if you have a choice, wherever you go for your first vaccine, it's very, very likely that that's where you're going to get your second vaccine. So even if it means that you have to get in the car and drive a little bit further, if you can get an appointment, get an appointment. And now the system is working easier. Most of us had to actually look for the second appointment. It wasn't assigned to us, but now the system works much better. Once you have the first appointment, you may not get a second appointment immediately, but you will be in the system and you will be notified when you are due to get your second one. And 99% you'll get it at the same site that you got your first vaccine.
Thank you, Ari. And the lines are really not that bad. I mean, depending where you go, and the system hopefully will improve with time. Hot topic number 2 is COVID testing. Everybody's talking about testing. When should I get tested for COVID? Well, you don't. There's no need to get tested for COVID routinely unless your job requires it. I know we have Jack here, who gets tested working on the set. But you need to get tested in 2 occasions. If you have COVID symptoms or any symptoms at this time, get tested for COVID. Or if you had an exposure. And an exposure means it's not just walking next to somebody who had COVID. That's not an exposure. An exposure is being fully exposed, meaning without a mask, without PPE, and the COVID person was the same, without a mask and not protected. That's a true exposure. And if that's the case, if you find out about that, immediately go ahead and test yourself. And a common question that I've noticed is, and I'll give you just an example. We are meeting for a birthday and everybody's taking the COVID test before, and we're just going to be unmasked. So I had to think about it for a couple of minutes. You have to treat any outside person as if they carry COVID. There's a lot of misconception about testing. There's a lot of fraud, which is another issue, but a lot of misconception of what type of tests to take, what is true, what is false positive or false negative. To understand what is a test, what does a test result mean, we need to understand what is the test, what type of tests are out there. And there are 2 main tests, and that's important for everybody to understand at a very basic level. We have a PCR test and we have an antigen test. And again, there are a lot of misconceptions and confusion between those 2 tests. And you may be taking a test thinking you have no COVID and you're seeing your friends without a mask, and that's not a good idea. So what is a PCR? A PCR is a type of test that detects the virus genetic material. It tests the exact RNA material that the virus is composed of. It's considered the gold standard. It's taken by a nasal swab or from the saliva, and it's highly accurate. But you need to wait a few days, 5 to 7 days, from the moment of exposure till the body develops enough viral load, enough viruses in the body or viri in the body, so the PCR can pick it up in the nasal swab or in the saliva. So when you get a positive test with a PCR, it's positive. It's true positive. It's beyond any doubt. It's the gold standard. But if you get a negative, and if you test too early, it may not mean anything. So you can get the PCR test result usually within a day or 2. Some places can give you the result within a few hours, but usually a couple of days. An antigen test detects the virus surface protein, those little spikes. Some people call it a rapid test because you can get the results within an hour. However, it's not very accurate. You can get a lot of false negatives. So if it's positive on an antigen test, then you may want to do a PCR just to confirm it. But if it's negative, don't count on it as being COVID negative. So it's extremely important to understand the two types of tests that are out there. So if you had some type of idea to be like create a super spreader event and to meet with your friends for a birthday after a COVID test, well, don't do it. If you wanted to meet people, you actually have to quarantine for 2 weeks. At least it says 5 to 7 days, but 2 weeks to make sure there are no symptoms. Then do a PCR test, wait for the results, quarantine until you get the results. It's just something that is not practical. So not something that you'd like to do. So until then, always be fully protected, stay socially distanced, physically distanced, and protect yourself. Masks are mandatory. Eye protection is mandatory. Our office is a masked environment. You will not see one person without a mask at even 1 second of the day. So we mask and shielded, and we'll talk about what type of mask to use. And this allows us to practice in a safe way with the highest level of protection. So let's talk a little bit about what's new with masks. Is it okay to use a cloth mask, or should we all move to surgical masks? So last time when we held a webinar for our patients, we definitely said that a cloth mask can be okay, and it's approved by the CDC. And back then, there was a tremendous shortage in the supply chain, shortage in PPE, including masks. There's still shortage, but not as bad as it used to be. So wherever you can, transition to surgical masks, a level 2, level 3 surgical mask, N95, KN95. Up your game in terms of masks, because it does make a difference and you need to protect yourself. You can wear the cloth mask underneath, on top of it if you'd like, but wear the surgical mask underneath. So surgical mask, K95, and N95 with a valve, and N95 without a valve. These are all great, but the key is the adaptation. So the masks that have ear loops are not as well adapted. And if they feel kind of loose over your face, then there's ways to improve the tightness. You can tie something underneath. You can actually make the ear loop a little bit shorter by tying a knot. But there's no doubt that the better adaptation comes from a mask that has 2 straps, over the head straps, one around your head, one around the neck, and it will be much kinder to your ears as opposed to the ear loops. They're not as difficult to get right now. This is a company that we work with. We have by the way, no affiliation with any company whatsoever. We're simply conveying what resources are out there. You can get K95s, no problem at all. You can get the ear loops, and you can make them a little bit tighter by creating a knot. How about those masks with an exhalation valve? Well, you're protecting yourself, but the valve works as such that it does not protect anybody else around you, because it's pure air coming through it. So it's a unidirectional valve, one-way street. And we don't recommend you use it. And many places, and also if you fly, they will not allow you to fly with a mask with a valve. So either you cover it or you just simply use a different one. In the office, we use the highest protection, P100, with filters, whether it's a half mask or a full face mask. And we always have the exhalation valve covered, whether it's external, like you're seeing here in the photo, or internal. We have special filters inside the exhalation valve. And our surgical caps are such that they have those cute little buttons where we can attach the ear loops, and it makes the mask very, very tight and safe for us and safe for our patients and other team members. How about kids? What's new with kids? Most kids would wear a cloth mask, and that's okay over 2 years old. However, there's more availability now on the market to get better protection for kids. And this is my daughter during a visit to the doctor, fully masked with a surgical mask, with a face shield. She wanted to wear gloves, and that's okay too. Keep yourselves and your kids safe. KN95 for kids are also available now. They're much better adapted. They're great for sports activities. They're great for, let's say, a pod type of learning experience. They just work better than a cloth mask. And they also come in different colors and different designs. And this is definitely available to purchase. Here's one company. Simply look them up. They're very inexpensive, and just order them. It may take 2-3 weeks to arrive, but get them and supply your kids with these types of masks. They're much better for their protection. Now, eye protection is just as important, whether you're using glasses, goggles, or shields. Protect your eyes. There can be transmission of the COVID virus through the eyes, and just glasses, computer glasses, or glasses for eyesight are not enough. They're not enough. You need to use eye protection, professional eye protection. It's very inexpensive, very affordable. These are the glasses that we personally use in the office, in our personal life. So this is an example of a 3M safety glasses. You can see, very simple, very inexpensive. You can order on Amazon. It'll get there the next day. But when you are around more people, like in a market, for example, you're going to a medical building, buy goggles. Same, this is the brand that we like here in the office, and also personally, I use it. I always have this mask, this eye protection goggles in my car. They look big, but they're relatively small, and they're very well adapted to the face. And then we have other ones that are much bigger, and we'll provide you with the links on how to order them. Again, we're not affiliated with these companies. We're not getting any percentages. We're just letting you know where we got our own protection. Now, wearing shields is great as well. You can combine eye protection with a shield. It has the advantage of covering your face, covering your cheek from splatter. Definitely when we work, we have shield our whole office. We have shields that can also be customized depending on the occasion. Valentine's is coming up, so we are prepared already. And same company is providing those masks. They're very, very affordable, inexpensive. Make sure to get replacements. So the actual shield itself has two components: the part that fits over your head and the shield itself, and you replenish it or disinfect it, and it'll last you a very, very long time. So how to gear up? Depending where you're at. If you're just going on a jog, walking your dog, it's definitely enough to wear a surgical mask and glasses, protective glasses. You're not around people, you're not in a crowd, you're not in a rock concert. It's quite reasonable to wear this type of protection. However, if you're going to a market, and depending what market, if you go into markets, there are a lot of people around you. Keep the distance, wear your surgical mask, but now upgrade to goggles or a shield. More protection. Some like to wear gloves. I think that's a great thing to wear gloves, but don't confuse gloves with being able to touch everything, because the gloves get contaminated. And many times I see people wearing gloves, but touching their face with their dirty gloves. Not a great thing. It's almost better not to wear gloves and simply disinfect your hands and wash your hands with soap and water. Soap and water works great. And when you go to a medical building or go see the dentist, come into the building wearing your surgical mask and goggles. This is me getting my dental treatment and cleanings. I make sure that my dentist, my operator, is wearing the highest protection, like in our office, a P100 face shield, same protocols that we implement in our office. And when we treat patients, our surgeries, because a lot of them are computerized, they're pretty quick. So you show up for your appointment fully masked and with goggles and eye protection. You take off your mask just for the treatment. Some of our surgeries literally take 20 to 30 minutes when they're computerized. At the end of the treatment, put your mask back on and fast checkout. We check you out electronically. Payments are done electronically, and this whole process is much easier now. Now, Lysol and Clorox wipes were very hard to come by, Ari. What
Yeah,
are your
it
thoughts?
used to be like a game, and we know some people who said, I managed to get five. Somebody else had a competition, and he got a hold of four Lysol or Clorox, and they were all back ordered. And there was a reason for it. We were concerned. We wanted to keep all surfaces, clean and disinfectant. But certainly, we want to make sure that all our patients are aware the game has changed. It's not anymore about surfaces. And by you speaking about goggles and mask and everything now is about the air quality. We know that it's common sense to protect surfaces and make sure everything is clean. But even if we touch anything and or surfaces and then wash our hands with soap and warm water, we know we are protected. But we do know now that the virus, unfortunately, is in the air and that the air quality becomes more important. So I would very much encourage people not anymore to buy in bulk and go from one supermarket to the other or on computer sites look for disinfection of surfaces, but be more concerned about the air and therefore also, as you said before, protect the eyes, protect the nose, protect where the virus can enter your body. This is a little repeat from the first lecture. And by the way, Dr. Simon will reiterate that everything we talked already previously about is available for you to watch on our website. But just as a small repeat, in our office, we decided to go with the highest quality of air filters. And we have in every room, including the reception area, treatment rooms, as well as where our staff is working, we have the IQ Air. And basically, this machine is expensive, but works very well for the protection of our staff, patients, and ourselves. We have different machines that we can share with you that the information was shared in the previous slide. But again, we want to make sure that you walk away from this lecture understanding that the emphasis has changed from surfaces to the quality of the air. So we have to be concerned about the air. So we encourage everybody that either if you're at home and you're sitting in your home, in your apartment or whatever, make sure if the weather allows it, keep the windows open. If you can, buy different kind of air filters. IQ Air is expensive. They are less expensive and models that are smaller for smaller rooms and or apartments like the Molecule. But look around and educate yourself. And if you are in a closed environment, we highly recommend to have air filters around. Some people have noticed that in our office, on top of the air filters, on top of the very strong vacuum that we are using close to the mouth to remove aerosols, we have small little dispensers of vaporizers that basically emit a very small little mist. We are putting into those vaporizers the solution of HOCl that we talked in the first round of our seminars, is hypochloric acid. Sounds very bad, but it is very innocuous. It kills the virus in the air, and you will see those little vases sitting in our waiting room in certain areas of the treatment rooms. And again, when you go back to the first Zoom lectures for the patients, you will see all the necessary information where you can order, or even with certain apparatus that looks like little coffee machine, make that HOCl solution by yourself. People have noticed also that during the day and before and after we see patients, and especially at night, we are vaporizing the whole office, which with much larger air foggers that contain this particular chemical that is very innocuous, that dries up in 2 seconds, but we are basically fogging the whole office in between surgeries, in between appointments, as well as at the end of the day. Again, everything is about the air quality to make sure that we are not cleaning only the surfaces, but also the air quality.
Yeah, so the focus right now is health. We need to be strong to withstand the virus. There are some questions here about why do we need to take a vaccine if uh, why take the vaccine if you can still transmit it? Well, we take the vaccine so in case we contract COVID, our body is prepared for it. That is the reason, and that's correct. If we are vaccinated, we can still carry it without suffering the disease. We can carry it to somebody else. So we still have ways to go in fighting the pandemic. So health is really number one, and the triangle of health has three components. Number one, nutrition. We have to have excellent, healthy nutrition to support the immune system and support our body in thriving and living a healthy life. Second component is exercise, and the third is sleep. And when we talk about exercise, it's never been easier to exercise. I'm probably never going to go back to the gym. Between the Peloton and having the mirror at home where you can stream exercise, you can do them live. My kids love it. It's just a great thing to have. You can actually get in better shape now than before, saving time, doing it at home, much more efficient, and makes you think, why did I go to the gym? All those decades. It was not necessary for me, and I see a lot of people like Ari, like myself, upping their game in terms of exercise. Nutrition, Ari, what about nutrition?
I would just get back to exercise that for all the patients who have visited our office and seen me and seen you, some patients who know me for a long time made the comment, are you okay? You lost weight or whatever. And yes, I actually lost some healthy 7 pounds that may have been on my hips or belly. And I have to admit that in the last year, I have physically never been in that great shape because, again, by not going to restaurants and by not going at night to any social affairs and or professional affairs, I exercise much more, and I've been in the best shape ever and taking advantage of this crisis the best I could by putting myself in the best condition. And again, to revisit the issues of what we talked previously in our Zoom seminars to our patients, we both believe that besides having good nutrition, it's very important to have supplements. And we know now that scientifically that diet matters in order for us to be in good shape, that if we get COVID, we survive it easier or prevent COVID. So we personally believe in supplements, and we have reviewed, and this is a little review here, scientifically that dietary factors can reduce COVID mortality and make sure that you either don't get it or survive it easier. So as a repetition, we have spoken before about the importance that a lot of us have avoided the sun because we don't want to get skin cancer and therefore we are deficient in vitamin D, and that we have to up the intake of vitamin D, and that vitamin D is very important for our general health and also as a prevention for COVID. And if you're getting COVID, you are surviving it easier with vitamin D, vitamin zinc. We spoke about NAC and vitamin C. And then again, we are not physicians, but we have searched the literature and we have found a lot of evidence that quercetin, which can be bought anywhere at line or in any one of the supermarket, helps the immune system. And there is some very, very strong research, especially in the Far East, that Sambuca combined with zinc, and you see here that particular now factory or outfit that makes it. We made it a habit. Everybody in the office is taking one of those lozenges once a day. And there is some strong research that Sambucus, when it's being ingested as a lozenge, helps in the back and the throat to kill the virus, especially the COVID virus. So we have added that to the routine in the office, into our family. And I have shown everybody here the zinc gluconate and some mushrooms supplements. And the addition today that I wanted to add, that new research has shown that we can add some other vitamins to it if you believe in prevention. The long Latin name of epigallocatechin chalate is basically chemically the products of green tea. Everybody knows that green tea is very healthy. I particularly don't like the taste of green tea and rather drink coffee or whatever. So I added this to the routine of myself, the family, as well as in the office. And there is some very strong research showing that this is helpful for your immune system, in particularly also regarding COVID prevention. Strangely enough, I'm now, and everybody knows that I've been 40 years in business and I'm now 70 years old. So it's a little bit more difficult to fall asleep in general. And I've used melatonin instead of using sleeping medication. And there is now definitive research showing that melatonin somehow makes your cells stronger for the virus not to enter. And so we'll show you later on like a whole slide of summary, but basically either you're taking melatonin as prevention and improvement for your body, or if you are having kind of sleep problems, I would say try melatonin, especially now since it has been shown to be effective in prevention of COVID, and you'll get a good night's sleep. Lastly, we have reviewed before that there are so many different mouthwashes on the market to begin with. We like to share with you that, again, we have absolutely no ties to companies or whatever, but we are using this in the office, and we believe very strongly that this particular rinse, the IO rinse, is a great rinse to prevent bleeding gums, to have better health, but it has also been shown scientifically in double-blind studies that this particular rinse not only improves the conditions of your gums, but happens to be one of the few rinses that kills the virus. So we tell our patients, you can rinse with the IO rinse after you brush, after you floss, in order to make your mouth healthier, but add to it that you're going to gargle for 30 to 60 seconds with it, because why did Dr. Simon say that we have to wear a mask and we have to protect our eyes and protect our noses? This is where the virus enters the body. That's the only entry to the body. And it enters then and sits in the back of your throat. And that's where our body is either fighting it, or that's where it sits there and enters into the bloodstream and into your lungs. So we have an opportunity that if we, God forbid, get in contact with this virus, that this particular rinse kills it. I'm going so far because I'm retentive and trying to be going overboard. This company provides also a nasal spray in case you have inhaled the virus. So you can combine it with either a nasal spray and the mouth rinse, or separate. And both of it has zero side effect, actually tastes great. For those people who are going to Google this particular product, please be aware that when you go to that company, there's a separate division for dentists and professional and a separate division for consumers. And it's very easy to order it, or you want to make your life even easier. If you go to Amazon and you buy it there, it's just a few dollars more and you can order it from there. But we very strongly recommend to use this.
Great. Very, very important and very, very helpful. Ari, these are all preventative things that we use in the office and we use ourselves. Here, it's just on my desk, and you have to make it a habit. We forget, and when we run out, then it's hard. There's no big reward in buying more medications. So make it into a habit. For myself, I have all those vitamins here, and I always have water on my desk. So it's a routine sitting at my desk in the morning, 7 o'clock in the morning, I take all my vitamins. Now, I have an unfair advantage. When the bottle runs out, Ari checks and he gets me more. So thank you, Ari.
Gladly. And lastly, again, because as I always tell my patients when they come in either for consultation or we talk now about COVID, we want you to be educated consumers. And again, Dr. Simon and me will disclose that you are obviously not physicians, but why do we bring this slide in there? There are now new treatment modalities that if you, God forbid, are symptomatic and have been diagnosed with COVID, the treatment modalities have improved so drastically. So if, God forbid, anybody gets COVID today, they're in much better stage and condition than a year ago. So I'm mentioning just this product, Regeneron, only because we have had friends and patients who called us. Unfortunately, their physicians are difficult to get a hold of. They are certainly overworked. Nobody wants to go to the emergency rooms. So please be aware that there are two products, the Lilly product as well as the Regeneron product. And basically those monoclonal antibodies are a wonder drug. This is basically when you hear the VIPs, Trump and other people who got infected by COVID, who got it, and 2-3 days later, they appear to be back to normal and getting back on their job. Basically, be educated that if, God forbid, you have it, that you have to be your best ombudsman and mention to your physician that there are outpatient clinics in Cedars as well as at CVS and pharmacies, that if you get a prescription from your physician and you qualified with the right qualification, meaning you have to have a fever, you have to have a certain age group or whatever, but if you can get this IV treatment that is basically an outpatient treatment, I have seen personally with my own eyes, friends and people that we know who are miraculously recovering, even so they felt very sick. So we mention this only so you have the knowledge, and sometimes you have to be your best ombudsman and mention it to your physician. Am I a good candidate for Regeneron or the Eli Lilly product? So we wanted just to mention this. And one last thing, again, this is a medication that we dentists are not prescribing, but there is some very strong research showing that this particular drug, the Ivermectin, that has been used for many, many years, I'm talking about not 10, 20, 30, 40 years, and it's an anti-parasite drug with very, very little side effects that has to be prescribed by your physician, either because of if you are in the age group that you are qualified for the COVID vaccine, but somehow for other reason can't get it, or if, God forbid, you get the early symptoms of COVID. It has been shown that if you are taking this particular oral medication, that it is either prevention for COVID or treating COVID and making you to overcome it very easily. So again, we are not physicians, but we want you to be educated and speak to your physician about it. There's also some research that, the next slide, Ziv, is that antacid are somehow preventing people from getting COVID. There are some research papers showing that people who have to take antacid on a regular basis are getting less COVID. And again, when you're getting COVID, that it reduces the symptoms. So we want to just make sure that you are educated. And I'm sharing you some slides here that will be available for you to review because the lecture is being taped. Plus, we will share this with you. There are prophylaxis protocols for people to take before or to prevent COVID. And there are protocols for the same medication in different doses to be taken when you are getting COVID and how to overcome it. So here you see the early patient protocol, God forbid if you have COVID, and the previous slide shows you how to prevent COVID. And we will share that with you if you call the office or if you see the lecture being taped for you to be an educated consumer and speak to your physician about it.
Excellent. So those protocols, it doesn't mean that you have to take them all at once, but it's a summary because heaven forbid if you contract COVID or you get exposed to COVID, you don't want to start looking through what you have. So it's great to have this protocol available. Get those supplements, medications to be available just in case. And that's what we personally did. Sleep is a whole other issue where the importance of sleep, especially for very driven and type A personalities like us, we always underestimated sleep and also looked at it as a point of weakness. Uh, my early days in the Israeli army, sleeping 4 or 5 hours a night kind of made it very acceptable and normal. Also through college and university, not sleeping was a medal of honor. No longer. Sleep is important, Ari. What do you think?
Well, I'm the kind of person that if I don't get a good night's sleep, I'm not the same as I like myself. And I think sleep is very, very important. So I've been a proponent of melatonin before COVID, and I've just increased my doses. But by now, everybody knows that in the office, as well as us privately, that you, Ziv, and me like to use technology, and we like to be surrounded by gadget and anything that's helping us. So I was lucky enough that my daughter, for a special occasion in my life, my birthday, gave me a present and introduced me to the Aura Ring. Again, we have no affiliation with it, but I love this device because it's a simple ring that you're wearing on your finger, and you can do that only before you go to sleep and take the ring off in the morning, or very similar to the iPhone, it will give you a lot of information. Now, this particular ring gives you information that is not available at this particular time on the iPhone, because it tells you not only if you wear it during the day, how many calories, and if you have exceeded calories, or if you should exercise more, but at night, it gives you enormous feedback about the quality of your sleep, because everybody knows that you can have a good 6 hour sleep and feel refreshed, or if you're having the wrong kind of sleep and interrupted sleep, that you can sleep longer and not feel refreshed. So this particular ring has attachment. I have no idea how they managed to get it in such a small device, but it basically tells you if you have the beneficial deep sleep, if you have the right amount of REM sleep. It tells you about the quality, and it has the feedback of telling you what to do the next day, when to go to sleep earlier, and what to improve. So I particularly love this kind of function of the ring and use it as a feedback to myself. I would only add to it that this is public knowledge. This particular Aura ring has now an affiliation with the Stanford University, and basically it is going to be shown in research, and Stanford is studying it, that they are now comparing the quality of the sleep and your heart rate and your heart rhythm to people who are wearing it and, God forbid, getting COVID, and what that means to your sleep quality and what you need to change or whatever. So I think a lot of research will come out of it. And it's another tool for people who like technology to get some feedback and improve the quality of their sleep.
Excellent. So we talked a little bit about disinfecting uh, things like our cell phones are some of the most contaminated objects that we deal with. We put it all sorts of places. We touch it with our hands. It's in pockets. It's thrown in the car. It's dirty. Disinfected. One of the ways to disinfect is use UVC. We have in the office a UV oven where we literally bake the masks. We can put in our P100, the N95, any type of mask can be put in the oven for a few minutes. It basically kills everything because it's a surface that is fully mirrored, and UVC is a light. It's actually very damaging light. It's damaging to the virus, but it will also be damaging to our skin and to our eyes. So you can't look at this light. You can't get exposed to it. Otherwise, we would have it in everywhere. So there's also home versions of it. There are smaller ones where you can basically disinfect your phone. Okay, so the light is inside, or bigger versions. This is from my house. We have this at home. I put my keys in, phone, glasses, anything that is potentially contaminated basically sits there. The UV disinfects it, and within a few seconds, you can take it out. There are also other devices that emit UVC, and this is not for children. It has to be kept away. That has to be handled with care. It actually comes with eye protection. And this is UVC Wand. You can disinfect surfaces. We use it in the office to disinfect different surfaces. The moment you turn it around, it will shut off. It's a protective mechanism that is built into this machine, and it's relatively affordable. I think this is about $100 to get, and you can buy it on Amazon as well. So to finish off our presentation, we noted as dental professionals and also working with many dentists in the community, with your dentists and many other specialists, the pandemic obviously created a lot of problems and a lot of hardship on the health system and on many of the sick people. But we also noted dental problems, oral disease that we wanted to share with you. And in case you didn't see a dentist for a long time, we wanted to offer some systems for you to self-check. What type of things have you seen, Ari, in the past almost year of the pandemic?
I mean, pretty obvious that everybody is definitely stressed out more because being worried about themselves, being worried about their family, being frustrated that they can't continue with their normal life of getting out of the house and either going to restaurant or travel. So I think the most common symptoms is that people are stressed. And unfortunately, when you are stressed, you can either get an ulcer or you can start grinding your teeth. And we have seen it, and we have seen it from the dentist colleague that we are working with, that unfortunately there is a huge increase of people breaking their teeth and people complaining about jaw pain.
Excellent. And also as periodontists, we also see more pockets, more inflammation. We've seen more lesions. Some of them are the human papillomavirus, HPV, nothing to do with COVID, but it's also an opportunistic infection that we see more in the mouth, and unfortunately also gum cancer, cancer of the gums around the teeth, that is much higher now, also personally seen in our office. So why do you think, Ari, we're seeing more people cracking their teeth? Why do we see more broken teeth, more the root canal problems, things like that?
I think it's a question of, as I mentioned before, people are stressed out, and one form of stressing out is grinding your teeth, and that's a very normal defense mechanism. And unfortunately, because we understand that, especially in the beginning, it was very scary to get out of the house, people postponed going to the dentist. People forgot that we mentioned, by the way, this tooth is not so strong. You need to have either a root canal, or you had a root canal, but you need to have a crown on this. And basically, it's human nature. People postpone treatment, and unfortunately, that postponement caused some problems.
Exactly. So we're seeing more lesions. Now, we don't know enough about the oral manifestation of COVID-19, but there are some reports of lesions that appear in the mouth. Of course, when one is infected, we haven't seen them in the office as yet, but it almost looks like a rash on the inside part of the cheek and the lip. And some people even call it the fourth key symptom of COVID. And that's something that we'll probably see more and more and more. So what we would encourage you is, regardless, examine yourself, self-examine, look in the mouth, use the iPhone flashlight, do it in front of the mirror, take a look at your tongue, take a look at the inside of the lip, try to sneak a peek into the inside of the cheek as best as possible. Much better for a dentist to do this, obviously, but do the best that you can. And especially pay attention to wounds that don't heal. Wounds in the mouth heal very, very quickly. If you ever burned your palate, the roof of the mouth with pizza, what we call a pizza burn, it hurts, but it heals within a day or two. It's very, very quick. Even if you cut yourself, things heal very rapidly. Where you have to be concerned about is when a wound doesn't heal, it constantly stays like a painful ulcer or something that just doesn't heal or constantly bleeds. Uh, Pay attention to patches on the tongue, on the lips, on the cheeks, on the gum tissue. And if those patches are mixed red and white, that is more suspicious. So the red color is not a red color. This is an example for the side of the tongue. This is actually cancer. It's called squamous cell carcinoma. And you see this area on the side of the tongue, right in here. That's where the lesion was. And that needs to be treated immediately with with different methods. Obviously, it needs to be removed first. So it's very easy to stick your tongue out, take a look at your tongue from all directions, look at things that are potentially abnormal, look at your gums. This anytime you're seeing an irregular surfaces in the mouth, except maybe the tongue, are pretty smooth. They're pretty homogeneous. They're pretty flat. So anytime you see an irregularity, something that looks like, we call it cauliflower appearance. It looks like something is not right. You have to contact a dental professional and have him or her look at it. This particular problem here is cancer of the gum. That's what it looks like, and we are magnifying it here on the screen. In the mouth, it's actually pretty small, but if not detected, it can lead to very 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 bad side effects and all the problems we see with cancer. Anything that looks dark, the mouth is not exposed to the sunlight, so we're not expected to see anything that is like that is a pigmentation, although it can be. So anything that is a change in color, a change in texture, a change in the surface, uh, pay attention to that. It's extremely important, especially if it's looks very irregular. This is an example. It's tiny, but we caught it. It's an HPV lesion, and it's very simple to treat it. We basically remove it, send it to a pathologist. We'll look at it under the microscope, and there's some other follow-up treatments for that. So examine yourself in front of a mirror, use a flashlight. If you're not sure, ask your partner, friend to take a look as well, take a good picture. You can send it to us. But the best thing is to really look at it, because we use illumination, we use magnification, and we can address it as needed. Now, we didn't want to talk just about bad things about the pandemic and bring you down. I hope this webinar was helpful to you and added some knowledge, even if we helped you with one or two things where tomorrow morning you can now implement, get your body stronger, more resistant, more protected, then we can sleep well at night with the Aura Ring. Ari, what great things happened during the pandemic?
I would just, before I address this here, I would just say that everybody knows in their life, and I know, unfortunately, some very close friends who are so afraid of COVID that for the last year, they were sitting in their apartment, they were sitting in their houses, they didn't work out, they didn't exercise. And I think personally that that was detrimental to them, because we know that the exercise and the fresh air, if done properly, as you showed, going out with a mask and going out with goggles or whatever, improves your immune system and makes you stronger. And I would just encourage everybody to get out of the cocoon. Don't let the COVID scare stop their regular life. And if they are concerned, to either send us pictures, come back to the office and get your cleanings done, because we know the mouth is an entry point for the virus to come in. So the healthier you are, the better you are. But when we speak about great things, I think we got educated in the last year. We improved ourselves last year. And myself and my family, everybody knows that I happen to love the arts. I happen to love and support contemporary art in Israel. So it gave me more time to be involved in Israel via Zoom. I myself and my wife are very proud to sponsor a prize for contemporary art in Israel. We are giving Zoom talks on computers as well as university-based forums. And this enriched our life very much. And not going out to restaurants and not stepping into planes, we took advantage of spending more time with our family. And we loved it. Here you can see some pictures of us in being in opening galleries before COVID. But now we took advantage of taking the family onto weekend trips. You can see to the left, we have been in a B&B, beautiful house in Lake Arrowhead. To the right, we just recently rented a house and brought all the food and never stepped out of the house to supermarkets or whatever, but took beautiful hikes with the family in the canyons of Palm Springs. Life is good. We are blessed. And I wish all of you to stay safe and healthy and use our resources and call us, let us be of any help, and for everybody to stay safe and healthy.
Thank you, Ari. Thank you. What a great photo. Yeah, we hope this webinar was helpful to you. Practice safety, protect yourself, use the right mask, protect your eyes, protect your health, eat well, exercise, sleep well, and you can go outside. Don't feel that you're locked. You can protect yourself, you can walk, you can exercise, and look up, because if you're looking down, you'll never see the rainbow. So thank you so much. And now we're going to answer some great questions here. Okay, good, Ari. Thank you for all the feedback. So a question here, do you recommend an antibody tests, or are they unreliable? Ari, what are your thoughts about antibody? We didn't talk about it that much.
Again, I would go back to what you said, that if you have any symptoms, I would trust only the PCR test. Everything else can really scare you. We have had, and Ziv knows about it, patient friends who were concerned because they felt either they had an exposure or they felt a little bit sick, and immediately called us and said, oh my God, what do we do? We have COVID, only to find out that a day later, because of us insisting on it taking a PCR test, that they actually got a false positive test or whatever. So I would say test only when necessary, when you have symptoms or exposure, and don't waste your time on the 15-minute test unless technology comes better and those 15-minute tests become more accurate, as close to the PCR test.
Okay, great answer. So great feedback here from Susan. Thank you so much for the information. We're indebted to your knowledge and caring of your patients. A big thank you. A question here from Francine, are the shields as protective for the eyes as goggles are? Thank you so much for this seminar. I'm so grateful that you are my doctors. What do you think, Ari? Shields versus goggles?
I would say if I have my choice, I would rather wear shields or goggles. I would rather have glasses or goggles. But for people who are afraid of spatter, for people who are going to the supermarket with a lot of people, I think shields are great on top of either glasses and goggles, and that would be the ultimate. The shields are the additional third protection after you have a mask and the eye protection.
Okay, great answer. Are the KN95 masks made in another country, are they safe? By the way, what is not made in another country? But what do you think about the KN95?
I think most of the masks are not made in the United States. And by now, there are some very good mechanisms that you can check under the qualification that they need to be FDA approved. And K95 masks just have a different form. Most of them have like a cone shape design. They are good as long as they are being done by, being produced by reputable companies. To add confusion to the fact, people will see me walking in the office when I'm not doing surgery and just exam with eye protection, shields, and a mask. And my mask that I happen to like very much is the K94. And that's a little variation. It's 1% less effective than the K95, but feels much more comfortable. And the K95 is synonymous with made in Korea. And that particular mask goes higher over your nose, goes deeper underneath your chin, but feels more comfortable. And I think as long as you choose any one of the N95, K95, or K94 that are now all available all over the internet, you're going to be safe. Just make sure, as Dr. Simon mentioned it, it's not about the wearing of the mask, but also the fitting, especially over your nose.
Great. There's a great question here from Kate. Are these supplements safe for teens?
You know what? That's a good question. I would say, in my limited knowledge as a dentist, I would recommend this only to everybody over 18. But uh, any one of those supplements can be discussed with your either physician or pediatrician if you are concerned that somebody's under 18. But I would say we are certainly not qualified to say that. Usually, every supplement is designed more for adults, anybody over 18. But that's a very good question that I would be very interested to know what podiatrists say.
Excellent. So yeah, please refer to the your kid's doctor for these before you
Pediatrician, sorry, not podiatrist.
pediatrician. Excellent. So great feedback here. You're both fabulous. Thank you for so much information from Michelle. Thank you for all the info, Tina. Learned a lot. How long does the vaccination last? I'm planning to travel abroad in October. Should I wait a while before getting the vaccination? I'm eligible now. Great question.
Again, my input would be is if you're eligible and you can get the vaccine, please get it now, because first you're protecting yourself. And unfortunately, we are surrounded by a lot of people who are either not vaccinated, who are either not practicing all the precautions. So I wouldn't time it regarding your travel. But I think the common knowledge is that the vaccine, any one of the vaccine, is protecting you for a minimum of 6 to 9 months. The talk out there that Dr. Simon and me are hearing is that sometimes in the fall, when we are getting ready to get our new flu shots, that flu shot either might be combined with one shot of a booster for the vaccine, or you get a separate booster. But I don't think that that's going to happen until late this year. So I think that if you're planning to get the vaccine now and travel in July, August, or October, you should be totally safe. I would only add, because I love traveling and I've never been that long without being out of the country, that the same like in LA or when you're traveling, and the same like Dr. Simon mentioned, once you have the vaccine, you are protecting yourself. But wherever you go, you are going to a different environment that may have different strains or whatever. And this is our problem. And this is why we hope a lot of people and more people would get vaccinated in LA, in California, in the United States, as well as abroad, because that will bring the whole herd mentality that wherever you go, you're not going to be exposed to either COVID or the new strains. So just being vaccinated doesn't protect you totally, because unfortunately, you know, there are other strains available.
Excellent. Very, very important information. Robert, thank you for the information, and I will be in soon for my cleaning. We'll see you soon. Excellent. Pam is asking, I bought some KN95 masks online that are too large for my face. How do I shop for a better fit when I can't try them on in advance? Practical question.
Ziv, I think you have shown this, that, you know, depending on your face morphology or whatever, you can double loop. You can double loop the loops behind your ear. And unfortunately, this is a problem because we are not going out and there are no places where you can try different masks on. So we have had the same problems, Ziv, when we started ordering masks for the office. We started in the beginning ordering hundreds of masks, and then we find out this mask actually is not fitting well or whatever. So now when we are ordering masks from a different or new manufacturer, we're ordering only 10 of them, or you as an individual order only 5 of them and try them on, and maybe order 2 different masks from different manufacturers. And only when you're finally satisfied, then, you know, consider buying more and supplying your whole supply.
Great. So Kate, thank you for this answer. And also thank you so much for this information. You're both wonderful, and I'm grateful for your skills, kindness, and humanity. Thank you, Kate. And it's great to have you here in this training. Shannon is asking, Shannon, I hope you're well. Do you and your family members wipe sterilized grocery store items when you bring them into your home? Absolutely. We use Clorox wipes. They're not as difficult to get anymore. We have a whole system. You'll see it in one of our previous webinars, the whole mechanism. We put them all inside a bucket, and then from the bucket they get sterilized, and then they're being put on the counter. We actually look at it as almost like a surgical procedure.
I would add to it, Ziv, that anybody who's visiting our office, we gladly will share with you the room where everything is coming in and how we are separating it. And again, everybody who can watch the previous Zoom seminar, Ziv has organized this very well. So just because we are now vaccinated, that doesn't mean that we have given up on all the other basics. Those basics have to stay in place. And the same like Dr. Simon mentioned before, keep those basics. Treat everybody, even if you're vaccinated, treat everybody who comes into contact to you, comes into your home as somebody assume having COVID, and be prevention oriented.
Excellent. The question from Eleanor. Hi, Eleanor. Can you use the mouthwash, the Rinse mouthwash every day? Thanks for the webinar, it's so helpful.
Definitely, that mouthwash can be used every day. Just because it's great against COVID doesn't mean you have to use it 10 times a day. I would say as a basic, because when you go to sleep and your tongue and your mouth are not active self-cleansing, I would recommend, if you have a choice to use it only once a day, use it after you brush and after you floss, rinse with it, gargle with it, go to sleep. Don't dilute it with any food or water. If you want to do it a second time, it's probably very convenient to do it after breakfast, after you brush your teeth. Use it once. Use it a third time, only if you think you came into contact with people who are not in practicing good prevention. If you think you were breathing somebody's different air or you were outside, nothing wrong to rinse it. The beautiful thing is that the rinse is iodine based, and iodine used to stain your teeth. This particular mouthwash does not stain your teeth. So that's a big advantage.
Yes, Eleanor, I just wanted to add, Eleanor, by all means, and please also recommend it to your husband with his circumstances. I think it's extremely important for him to use this rinse. Penelope, thank you for the travel advice. Very helpful. Shannon, many thanks for your generosity and caring for your patients by sharing this information. You're very welcome. Robert is asking, when I go for my daily walk, it's great that you're walking, it's great that you're keeping active. So many people don't have masks on. We don't get it. Do I need to wear a KN95 or can I just wear a cloth mask? Thank you. Ari, what are your thoughts when you go out and people are not wearing masks, or what? How does it change how we protect ourselves?
I think it's very upsetting, but I gave up to be the policeman of everybody. You can't argue with anybody. And, the police itself, even so, our new President Biden said that everybody should wear a mask everywhere, at least in official places or whatever. We are not here to argue with people. So I do daily my jogging. I take my dog out. And anytime I see a person who doesn't wear a mask on the sidewalk, I don't wait for the person to change their lane. I just make a big, huge circle around them, and I'm wearing myself the mask. So I'm not that concerned, and unfortunate for them if they're not smart enough to do this. But I think if you are not walking directly within less than 6 feet in front or behind them, you should not be concerned, especially if you're wearing a mask. And hopefully more and more people will learn to give the courtesy to others, as well as be smart enough to protect themselves. Exactly. Regarding outside walking, I think bandana is better than nothing. I think the simple surgical mask that protects you 25-30%, the very easy mask, better than bandana. And then wearing 95 or 94, certainly better than a cloth.
Great. And I wanted to say that the responsibility is on you. When you're driving your car on the freeway, it's your responsibility to drive safely and put a seatbelt on and follow all the rules. It's the same thing when you go outside. It's your responsibility to protect yourself, to protect your loved ones, because if you put yourself at a liability, at a risk of getting COVID, you will infect all your co-workers or your family members. So, everybody has to do their share, and it's not that difficult. Actually, it's very, very simple to be protected. Ari, there's a question here from Tina. Is ubiquinol the same as quercetin? Is that the same?
Yes, it's like some people combine it, but it's different names. It's all the same.
Great. Feedback here from Jack. Great information, great webinar, super kosher, glatt kosher. Would you recommend to take anything like Tylenol before taking the second vaccine to prevent side effects?
Again, I'm not a doctor, and we are not doctors or whatever, but there are some discussions in the scientific literature that you shouldn't be on steroids, you shouldn't be on any medication that reduces your immune response. And theoretically, maybe Advil is like an anti-inflammatory. But from all the talks that I spoke to, all physicians, Tylenol is definitely safe. And I feel like I'd rather err on the side of prevention. And so I took 2 Tylenol before my first and before my second shot, and I had very little side effect. By the way, in the office, how many staff members do we have now? I gave up counting, Ziv. But from all of them, I don't think anybody either called in sick because of symptoms after the first and second shot. And a few of them followed my advice of taking Tylenols before and afterwards, just to prevent the slight headache or the slight discomfort from the injection site. So check with your physician again, but I feel Tylenol is very safe.
Great. So we have 1 or 2 more questions. Great feedback here. Thank you all for attending this webinar. We have a lot of patients still with us and asking questions, so we will take our time. Thank you, Tina. You're both amazing, caring doctors. I appreciate all the information and your time. Thank you for sharing. Okay, great information and panel. Thank you from Nisa. Is Pyroxil, which you had mentioned in your last webinar, effective against COVID?
I would say yes. What we do in the office when patients are coming in for their regular either exam or coming in for their regular cleanings, you will notice that we have a protocol now of 2 little tiny containers. And we basically make you rinse with the rinse and the Pyroxil. Would be 1 enough? Yes. But again, us being on the side of erring on caution, there is scientific research that Pyroxil kills the COVID virus orally, and there is very good research about the rinse. So what we decided is we stocked up on both of the items, and every time a patient comes to see us, to protect them, protect our staff, and make sure that the mouth is nice and clean, everybody's rinsing with both Pyroxil as well as rinse. Is it necessary to do it at home? I would think it would be overkill, but I don't think you can hurt yourself.
Excellent. Very good. Ari, it's been a pleasure. Thank you all for attending this webinar. We hope we shared important information with you that you can now implement and take home to your friends and families. We will provide you with a replay link. And everything in this webinar was made for you. So we will have it available to you but with a replay, but also in as a document to be downloaded. And in the meanwhile, stay safe, stay healthy, and we look forward to seeing you at your next appointment. Thank you, Ari.
Thank you, everybody. Look forward to see all of you in good health.
Take care. Bye-bye.
Bye-bye.
Dear patient, it hasn't been easy to stay home, and it hasn't been easy to close our practice for all this time. But although we were closed, we started to plan our return. We envisioned a practice that is adapted to the current situation, a practice where you feel comfortable coming in and being treated in it, a practice that is corona safe. So we designed a workflow that addresses this, a workflow that is efficient in time and minimizes interactions and the number of people in the office. So how can we achieve that? Be efficient and practical and also deliver high-end treatment. Plus, make you feel how much we care about you. So here is how it goes. Your appointment will be scheduled over the phone, as always. We will be asking a few extra questions on the phone as part of our screening process. Thank you for your time answering them. You will get an appointment reminders to your email and phone as a text message. These would have a quick questionnaire that you will be answering. It's called the Wellness Form. We are doing this to ensure no patients with symptoms enter our office. We apply the same to the doctors and all team members in our practice. We also have a special protocol for handling mail and packages. These get disinfected before entering the practice. Now here's the first big difference. Don't just walk in. We will text you when we are ready for you. Then walk in. Make sure you wear a mask. Our office is a masked environment. If you don't have a mask, we'll provide one to you. We got you covered. In case you didn't fill out the wellness form, you'll fill it out there. It only takes a few seconds. By the way, we only allow scheduled patients to come in. We have a special protocol for all patients, which is the same as we are using for our staff. We will take your temperature, we'll ask you to sanitize your hands. You will see HEPA filters scattered around the office. These machines filter and remove all particles in the air, including the COVID virus. Then you're off to your treatment. We will ask you to pre-rinse before your treatment. This reduces the number of microorganisms in your mouth and minimizes contamination. Our treatment room has been prepared prior to your arrival to maximize the safety of your treatment. On top of that, we are using a special fogger that kills all viruses with a non-toxic solution. In our new protocols, we don't produce aerosols during a cleaning, and we will manually polish your teeth. As things evolve, we will keep you posted on the new protocols. If you are planned to have a procedure done, your check-in process will be the same. We will bring you to the treatment room, and besides the doctors and the assistants and the HEPA filter, you'll see another machine. This is a device that suctions all the aerosols and captures them. Look at it like a large vacuum cleaner for medical purposes. Our doctors and assistants will wear personal protective equipment, including a gown, a cap, a special mask, and a shield. It takes some time to put them on, but it's still us below. As much as we would want to, we will not be able to shake your hand. We are sorry. During the treatment, as always, we will focus on making sure you are comfortable. Medical offices tend to be cold, so make sure to bring a jacket or even a blanket. Feel free to use your phone or other devices to listen to music during your treatment. After getting post-operative instructions and some medications, you're set to go. Your follow-up appointment has already been scheduled and your payment has been processed. Thank you for entrusting us with your treatment. We appreciate your confidence. Speedy recovery. We got you covered.